today's media briefing are Governor Tony Evers, DHS Secretary-Designee Andrea Palm, and Laura Anderson, Family and Women's Health Nurse Practitioner at the Beloit Area Community Health Center. And available to answer your questions are Dr. Ryan Westergaard, a Chief Medical Officer with the DHS Bureau of Communicable Disease, and Ryan Nilsestein, the Chief Legal Counsel for the Governor's Office. We begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thanks so much for joining us today. Because of the good work you've been doing throughout this crisis to stay home as much as possible, practice good hygiene and social distancing, and wear a face mask in public if you're able to, Wisconsin was in a pretty good place in our battle against COVID-19. We had reached almost all our gating criteria. On Monday, we opened up 14,000 small businesses across the state, putting potentially 90,000 folks back to work in that industry. Despite that good work by Wisconsinites across our state who banded together, stayed home, and stayed safe, Republican legislatures have convinced 4 of our Supreme Court justices to throw our state into chaos. We saw it already last night when the Tavern League of Wisconsin urged its members to open back up and people flooded the bars across the state. Instead of a comprehensive statewide approach to keep people safe, we're seeing municipalities around the state chart their own course. That means you might have to follow a different set of rules than your neighbors across the street. And if you own businesses in multiple locations or have employees who live in a different community than the one they work in, things are going to get very confusing very fast. Even with all this chaos, we cannot let the court's ruling undo all the work we have done and all the sacrifices Wisconsins have made over these past few months. We need everybody to continue doing their part to keep our families, our neighbors, and our communities safe by continuing to stay safer at home, wear a mask in public if you can, practice social distancing, and limit travel because, folks, the Supreme Court may have changed the rules for how we operate, but it sure the heck didn't change how viruses operate. This virus has killed more than 400 of our family members, friends, and neighbors, and thousands more across our state are sick. Because of the court's decision, many more people could get sick and overwhelm our hospitals. But not if we stay the course and stay home. If you do not feel safe leaving the house, you should stay home. If you feel safe enough to go out to a store or a restaurant, but experience crowds or unsafe conditions that make you feel uncomfortable, you should go home. Just because Republicans said it can be a free-for-all, that doesn't mean we have to throw that good judgment out the window. I have already heard from a number of individuals and businesses who said they plan on continuing staying at home. I'd like to read one message I received from a constituent in La Crosse who said this: "As for me and my household, we will continue to abide by the guidelines your office set, even if they are no longer required by executive order. While I miss going to church, I can still exercise my freedom of religion by practicing it safely at home. While I miss sitting down at a restaurant, I still have the freedom to enjoy my favorite restaurant food from carry-out options. And while I love to bargain shop freely at secondhand stores, I can still do safely and freely through online options or with just 5 people in the store. You didn't take away any of my freedoms. You're helping protect them. And because of the good work and good freedoms that we have, if you're not alive and healthy to enjoy them, they mean nothing." I also heard from dozens of other folks: librarians, FedEx drivers, grocery store workers, cancer survivors like myself, healthcare workers, business owners, people from all over the state who support our efforts to stay safer at home and are hoping that you will continue to stay at home also. Their lives depend on it. Now it is more important than ever to make sure we are focused on keeping everybody safe, and especially that we consider those who are most exposed and vulnerable when we make decisions. We remain concerned and are working hard to keep people safe in our care, such as our healthcare facilities and correctional facilities, even though we understand how difficult it is right now for those individuals and their families. At this time, we do not have any diagnosed cases of COVID-19 at our Wisconsin veterans homes, which we attribute to the good practices we had in place and the protocols we added very early on. While safer at home order is no longer in effect in the interests of the health and welfare of our members and staff, our Wisconsin veterans homes will continue to follow the guidance of the Centers for Disease Control for our long-term care facilities and nursing homes by limiting visitation. And I know that other long-term care providers are making the same kind of considerations. This pandemic hasn't gone away, and the threat to frail older adults remains real and potentially dangerous. The Department of Health Services and the provider community are working hard to develop options and strategies to allow visitations to safely occur under certain circumstances and conditions. We all want visitations to occur and open up, but we don't want to thoughtlessly threaten the lives of older adults. Now, I know that folks are eager to visit their loved ones, and I understand that. I appreciate your patience and understanding as we all try and make sense of the situation and find solutions that will keep your loved ones safe. We also need to be diligent in our effort to keep our workers safe. WEDC has a comprehensive set of guidelines that we developed in consultation with DHS, and I strongly urge every business to implement these best practices to ensure the safety of every workplace in every community. Both customers and workers need to be confident in their safety, so we need everyone to be diligent in following best safety practices so that we can continue to move our state forward while keeping our neighbors, families, and communities safe and healthy. Regardless of the political overtones of the Supreme Court decision, we still know what we need to do. As I said before, the virus hasn't changed, and neither has the science. We will continue with our testing and contact tracing efforts around the state, and will continue to ensure our critical workers have the equipment they need to do their job safely. I urge anyone who needs a test to go get tested at one of our community testing sites and help protect your community and family from this virus. Let's stay the course, Wisconsin. I know you're up to this challenge. And now, before Secretary-designee Andrea Palm gives her daily update, I'd like you to hear from one of the healthcare workers on the front lines, Laura Anderson. Laura?
My name is Laura Anderson, and I am a family and women's health nurse practitioner at Community Health Systems in Beloit. Our clinic in Beloit is one of 18 community health centers in Wisconsin, providing access to basic healthcare services in communities that need them the most. Our doors are open to everyone, families and children, farm workers, the homeless, and those who are uninsured, on Medicaid, or who have private insurance. We are usually located in the heart of a medically underserved and vulnerable community. Prior to and during the COVID crisis, we have offered comprehensive medical, dental, and behavioral health services. We provide innovative care that reaches beyond the walls of traditional medicine, and we address the social determinants of health, things that I cannot possibly prescribe for, like food, shelter, and utility assistance. Our team addresses these very real issues. Through the efforts of experienced and passionate staff, we have resources including social work interpreters, insurance enrollment specialists, free nutrition and diabetic health education, a prescription assistance program, and an HIV clinic and case management through a partnership with UW Health. Historically, community health services have adapted quickly during the health crises. The HIV pandemic, SARS, H1N1, and today is no different. Our patients' needs have been always first and foremost. They are the reason we are here. We were one of the first to offer telephone and virtual visits for all three of our service lines, medical, dental, and behavioral health. We provide access to quality care to people who do not require emergency or intensive care. We function as shock absorbers to overwhelmed hospitals. We have been on the forefront of testing, providing services to those most in need, including families of those affected by the COVID-19 virus. According to the National Association of Community Health Centers, as of May 1st, community health service centers across the nation have provided over 356,000 tests. Among those tested, 59,000 were of racial and/or ethnic minorities, and in that group, 65% have tested positive. We have been effective because of our connection with patients and the relationships with providers. They feel trust coming to a place they know is safe. We develop and provide culturally appropriate health information. We offer consultation and put fears to rest. As things start to open up, people are worried and asking what they should do. We are here to listen to them and offer sound advice about staying safe. This is what I want you to know most of all. We are all in this together. Our health centers are uniquely positioned to address the health disparities that have become glaringly evident during this pandemic. These disparities are overwhelmingly affecting people who live in poverty and lack adequate housing or food, including many in our African American, Latino, and Asian communities. We provide services that people wouldn't be able to access without us. Our staff and our patients are a part of your community, and you are a part of ours. Thank you. And then I'm turning this back to Department of Health Services Secretary Andrea Palm.
Thank you. Good afternoon, everyone. I am Andrea Palm. I'm the Secretary Designee at the Wisconsin Department of Health Services. Thanks for joining us again today. I share Governor Evers' disappointment in the Supreme Court ruling. This decision will hamper our ability to protect the health and safety of Wisconsinites, and it risks increasing our cases and our deaths. In the face of this reality, I urge you to stick with us, Wisconsin, and continue to stay safer at home. Your commitment to flattening the curve has helped protect our frontline healthcare workers, our most vulnerable neighbors, and the capacity of our healthcare system more broadly. But there is more work to do. Yesterday's ruling changes nothing about the science of this virus or the work we need to continue to do together to safely reopen Wisconsin. And that is work that we have been doing together since we began our statewide response in early March. You can see our progress in the green gating criteria on our dashboard. As we've talked about many times, while you have been staying safer at home, we have been working to build up our healthcare and public health testing and contact tracing infrastructure to be able to detect positive cases quickly and help stop the disease from spreading further. But COVID-19 remains highly infectious, and it is why our Badger Bounce Back Plan outlines a gradual reopening through 3 phases. This phasing allows increasing amounts of interaction between and among Wisconsinites in a way that will help us manage the inevitable spread of the disease, reduce illness and death, and minimize the risk of a surge that would overwhelm our healthcare system. Physical distancing in this phased approach, along with the aggressive testing and contact tracing, will help protect the health and safety of Wisconsinites until there is an effective vaccine. What we have done so far together is working. DHS and our partners in this statewide response will continue to do the work of protecting the health and safety of Wisconsinites against this virus and safely reopen Wisconsin. I am asking all Wisconsinites to continue to do it with us. Here's where things stand today. We've got 52 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of 13,372 tests. We have 122,598 negative tests, which is an increase of 5,487 tests over yesterday. There are now 11,275 confirmed cases of COVID-19 here in Wisconsin, which is an increase of 373 over yesterday. Our total deaths have now reached 434. We currently have a total of 299 facility-wide public health investigations. And now we'll take your questions.
Thank you. Reminder to maintain audio quality, to keep the phones on mute until it's time to ask your question. And in the interest of time, because of the number of participants and our need to wrap up by 3 o'clock, please only one question per reporter. And we'll begin today with Scott Bauer from the Associated Press. Scott?
Hi, thank you again for doing this call. Governor, I wanted to get your reaction to Speaker Voss saying that it may be okay to not have a statewide plan, to not enact a rule, and to just leave it up to local governments to decide what the policies ought to be. What's your reaction to that? And I'm also wondering what Dr. Westergaard would think of that in terms of a public health ramification.
Yeah, and that was part of our conversation today, actually. I thought both leaders felt very comfortable with the idea that, and they are unconcerned about what I believe will be massive confusion that will exist without a statewide approach. Apparently, they believe that different rules are okay. We still, so I can't imagine another state that is in this predicament where essentially mile by mile there may be different rules across all of the state of Wisconsin. So disappointed in that, not surprised in that. That was part of the MO right from the beginning. It I do see some contradiction here, and that is, I remember receiving a letter shortly after it was dated May 1st. I don't know when I received it, but it was from Speaker Voss and some of his colleagues, and they made it clear to me that they were interested in a gradual and safe reopening of the state. Apparently between that at that time and when the Supreme Court made their decision, they decided that that wasn't what they wanted to do. I think it's a mistake, but the court decided, and they're the court of the land. At least 4 court members decided.
Thank you, Scott. Now to Mark Leland from WLUK TV in Green Bay. Mark?
Yeah, thank you very much. Republicans, well, let me ask this. How many counties have enacted their own continuance of your stay-at-home order? Are you reaching out to the others that haven't yet? And are those local orders legal? A lot of people raising questions, are they legal if the state order was not?
Sure. This is Ryan Elsisto, and I can answer that for the governor. I think last I checked, there were at least 5 or 6 counties that had enacted their own orders. I suspect, based on the amount of interest that we've heard from local public health officers, that there's going to be more counties and more municipalities that will be doing so. In terms of the legality, the public health officers have very broad authority under state law, while legislative Republicans and their allies on the Supreme Court overturned the state's efforts to do so on highly technical rulemaking grounds. Those same requirements for rulemaking do not apply to local health officers. So there isn't a connection between the Supreme Court's decision yesterday afternoon and what local public health officers are doing. And so, as the governor indicated, we're going to be seeing a patchwork of orders across the state, and that's authorized under state law.
This is Ryan Westergaard. I can add to that, and I know that Scott Bauer had also asked for a follow-up question in sort of the scientific or the medical perspective on local public health. And to that first question, I'd say that it's not necessarily a weakness or a bad thing for control of public health for those decisions to be at the local level. In fact, we rely on local public health as the leading edge of our statewide response in all things related to communicable diseases. So in principle, that's a good situation, a good solution. The limitation, however, is that the resources required to contain this epidemic at the local level so very quickly outstripped our ability to do the things locally that needed to be done. So whereas the locals are in the best position to do the epidemiology, to give quarantine orders, to give support, to make those local recommendations, this unfolded so quickly that we needed to have a statewide response to get on top of it. And as we've been trying to build our next generation public health system for the next year, we need to do that in a way that coordinates the resources at the state level and builds up local public health in a way that really hasn't been there there before. So the resources that local public health departments need right now to respond to this epidemic is going to be here for the next year or two. So the idea of us taking time, of us having a statewide response where we're trying to mitigate the epidemic on a statewide level was critical in our opinion to, number one, make sure there's some uniformity in our response, but number two, give all of us time to build the resources locally that we need to be able to contain local epidemics and prevent them from becoming large generalized epidemics. So we hope and we want locals to make decisions and to have that authority, but they need support to do this at a scale that really hasn't been needed to be done in our lifetimes. So that's really the challenge, and that's really why the state is such an important resource and support.
Thank you, Mark. Now to Mason Dowling from WAOW-TV in Wausau. Mason?
Hi, thank you for taking this call. Our question was this. We've had several business owners in the Wausau area make a Facebook post or email, something along those lines, saying that they're still trying to figure out how best to re-implement their businesses, but they're concerned because a lot of their employees are currently making more money off of unemployment than they would have been while they were working. Is the state doing anything to address the kind of the unemployment disparity?
Well, the level of workers' unemployment insurance is determined by, in great part, by the federal government. So, frankly, there's not much we can do as a state, especially now that we have no authority over this issue, to do anything about lowering someone's workers' or unemployment insurance. Frankly, I think that would be a very unpopular thing, and so even if we did have that authority, I would not support it.
Thank you, Mason. Now to Rich Kramer from Wisconsin Public Radio. Rich? And a reminder, *6 to unmute your phones. Rich Kramer from Wisconsin Public Radio.
Sorry about that. Thanks for taking the question. I'm just wondering, since it seems that the court order allows DHS to some authority over the public school system, I'm wondering if there's any timeline or date for when public schools may open. I mean, summer classes, I don't know about that, but at least for this fall.
We are working along with the state superintendent of schools, Carolyn Stanford Taylor, with lots of groups that are interested in helping plan that. In fact, the two legislators I was with today also want to have a chance to have that conversation. So it's ongoing. No decision's been made. My preference would be that in the K through 12 world that it should be our goal to have school open next fall, but we certainly must have a plan A, B, and C, and D, because given the circumstances, we're not sure what things are going to look like this fall. But ongoing discussions are happening.
Thank you, Rich. Now to Jessica Van Egren from Up North News. Jessica.
Yes, my question has to do with last night's ruling. I'm wondering what the state and maybe DHS specifically is still able to do to coordinate statewide efforts like Dr. Westergaard was discussing. What is the state still able to do to help build up local health departments?
Thanks, Jessica. So I think it's an important thing that we all need to stay focused on. The virus and the outbreak are the same today as they were yesterday, and the work we need to do to defeat this virus and to protect the health and safety of the people of this state remains the same, and that is to continue to do the work of building up our testing. Our capacity is at a good level, but we still are not using all of those tests on a daily basis. People who need tests need to go get tested. We need to continue to do the work of bringing on board contact tracers. Our goal was 1,000. We are ramping that up. We We are starting to onboard additional contact tracers next week. That is critical work to help local public health departments across this state interview every positive case and all of their close contacts to stop the spread as quickly as possible. We continue to do the work of procuring necessary PPE. That continues to be a struggle for us and states all across this country to make sure we have the protective equipment necessary for our frontline healthcare workers. And we'll continue to do the other work that is necessary as part of our statewide response to stop the spread of this disease. And it is why we are asking Wisconsinites to stick with us, to continue to stay safer at home, to continue to do the important work they have been doing to give us the space and time to stand up this infrastructure, which are the tools that we need to stop the spread, because it remains as infectious today as it was yesterday, and that means that physical distancing is critical to not resulting in spikes of this disease and surges that could overwhelm the healthcare system. And so we've got to do the work that was the same today as it was yesterday, but people need to remember that the virus is still just as infectious and circulating widely in public without practicing physical distancing, without staying safer at home, will encourage the spread of this disease. And so we are encouraging Wisconsinites to continue to practice safer at home and help us stop the spread.
Thank you, Jessica. Now to Cammie Rapson from WBAY TV in Green Bay. Cammie?
Good afternoon. Governor, I'm looking for specifics on your discussions with Republicans today. Who did you speak with? When did you speak with them? For how long? What was discussed? Are any talks scheduled for the future? And is there any way the Badger Bounce Back survives these talks? Thank you.
That's several questions. And I couldn't tell you the exact time. I wasn't keeping track. I talked to, on the phone with me today was Speaker Voss and Majority Leader Fitzgerald, some staff members, and some staff members with me. We didn't, unlike the promise that was made in the Supreme Court case, that there was a plan. Didn't hear anything about that. And it was obvious to me through the conversations that the majority leadership was pretty much unconcerned about the confusion that having multiple counties and municipalities having different rules and regulations. They're pretty okay with that. They can speak to that. It was a respectful conversation. And as I said before, there didn't seem to be any interest in having a gradual and safe reopening that was suggested in a letter to me not too long ago. So that said, we talked about the possibility of an administrative rule, which will take a long time, unlike what was stated in the court case. It's going to be 14 days minimum. And we talked about some possible things to have in that process. So nothing. No fireworks, just making clear that they were very pleased with the results and they're okay with having confusion. And it was a respectful conversation, and we'll probably meet again next week.
Thank you, Cammie. Now to Emily Fannin from WKOW-TV in Madison. Emily?
Governor, do you still plan to introduce a new statewide plan with Republican leaders, even though they seem to be leaning towards a county-by-county approach? Also, Speaker Voss said he wants to move quickly on new rules for businesses to follow. Did you discuss what those might be?
No, they seem to be indicating that, I believe in this conversation or their public statements, that they're pleased with the WEDC's work in this area. But no, the Supreme Court made it clear, this is not our gig. What we are going to be continuing to focus on is making sure that we have contact tracing and massive testing to make sure we have equipment for those frontline workers, and that we attack and deal with any surge that will happen because of this decision by the state Supreme Court.
Thank you, Emily. Now to Riley Betterkin from the Wisconsin State Journal. Riley?
Thanks for taking my call. Governor Evers, could you please describe what the starting point is for negotiations for Republicans? In other words, what are the bare minimum restrictions that you're willing to accept and that Republicans are willing to accept, if any, in this emergency rule that'll be promulgated?
We made no decisions on that today.
Thank you, Riley. Now to Gwen Ginther from the Wheeler Report. Gwen? And a reminder.
Governor, can you say what you plan to advise state employees to do? And do you plan to make any changes to what you're doing right now with the state parks or with the opening or closing of the state capitol?
The state parks, we've opened them up, and so I don't see any changes there. I haven't had a chance to talk to the secretary in a couple days about that, but it seems things seem to be working out just fine. As far as state employees, we are continuing with as many opportunities for people to work from home as possible. And of course, a lot of them are busy figuring out how to make cuts in their operation costs. And so that's tough work, and they're busy doing that. And also, frankly, all of our agencies are doing yeoman work and making sure that the people of Wisconsin are kept safe no matter in what venue they're in. So it's the state capitol building, it remains closed for the time being.
Thank you, Gwen. Now to WISN TV in Milwaukee. WISN.
Hi, Governor.
Hi.
Governor, this is Kent Wingcat. Listen, just a quick question for you, kind of your opinion on this. We've heard Republican lawmakers say that we need to trust our business owners to reopen responsibly and safely and to ensure that their customers are physically distancing, but you referenced those bars were crowded within a matter of minutes of the court's ruling. So given what you saw in those cases, do you think Wisconsin can remain safe without a statewide plan?
I think it's going to be very difficult. I mean, clearly, there wasn't any physical distancing going on from what I saw in those pictures. But you know, I wasn't there, so I guess I can't make a final decision. But if you're not doing the basics, of course there's going to be increased numbers. There's very few certainties in this world of COVID-19, but this one is certain. The more people you put in a small space, the greater the chance are you're going to get the disease. And so if businesses don't do that or don't create opportunities for people to be physically distant from each other, it's going to be a problem.
Thank you, Kent. Now to Jonathan Neiser from NBC 26 in Green Bay. Jonathan?
Yes. The governor mentioned this as part of his first statement in context of the veterans' homes in the state. It was my understanding the Center for Medicare and Medicaid Services and CDC issued the nursing home visitation restriction for the long-term care facilities. Outside of any county or municipal order that was just recently created in response to the Supreme Court decision, is there anything else the state can identify that people can't do now despite the safer at home being overturned?
As it relates to long-term care?
I mean just across the board. Is there anything that's off limits now above and beyond that, the long-term care, no visitation?
I think I can probably answer that question. So, as the governor mentioned, part of the challenge with the Supreme Court's decision and legislative Republicans suing over this but not having a plan B is that it does take away the statewide approach. There are going to be limited situations in which, like whether it's long-term facilities, like you mentioned, where there are other regulations in place, whether on the federal level or state level. But one of the challenges here, with there being no Plan B in place being offered by the Republican legislative leadership, is that it is creating this patchwork approach. And so you are going to see different regulations and different rules at place in Dane County versus Sauk County versus Marathon County versus Brown County. And so people are going to have to be cognizant of which local public health officer oversees their area and what specific rules are in place for their specific area. And what, and that said, I think, the administration is going to continue moving forward regardless of the decision from the court yesterday to make sure that people have best practices and best guidance, and we're going to look at what tools we have available. But unfortunately, with the court's decision and the lack of a backup plan from the other side, it does create this patchwork situation that we're in now.
Thank you, Jonathan. Now to Addie Bink from WFRB TV in Green Bay. Addie?
Thanks for taking my question. I noticed that our testing capacity within the state, within the labs, has gone down recently. I was just wondering if you could explain why that is and how quickly that capacity could be increased if it was needed.
So Addie, I assume you're talking about the fact that we dropped from like 13,800-ish down to about 13,200 and change, if I'm remembering my numbers correctly. When I talked to the folks this morning, it sounds like we do have a couple of labs that are experiencing some reagent shortage, and that is reflected in the decrease of 700-800 tests on a daily basis. Because as you know, we track those things closely with our lab partners, so we understand what our daily capacity is, and those numbers can fluctuate on a daily basis depending on the status of supplies at each of the labs that are participating with us.
Thank you, Addie. Now to Steve Westergaard from the Platteville Journal. Steve?
Thanks for taking my question. And this is a question for the governor. I'm wondering if in the now that the state Supreme Court has basically negated safer at home, if you now believe that you should have taken a different approach to this, such as going through the rules-making process from the start, even if it would have taken a couple of weeks up at the start, or having a different plan possibly in mind to work with the legislature to enact if the order was in fact negated, as happened yesterday?
Well, no, I don't have any regrets for what we did. We, in a short 4 or 5 week span, we have created a system where we have in a major way changed the face of public health in the state of Wisconsin. We have massive testing going on. We're getting to a place now where contact tracing is going to give us a chance to really corral this virus. We're getting much better support from the federal government finally on the issue of equipment. And so, no, I mean, we might still be going through the rulemaking process if we had done that. And frankly, that's assuming that that decision that they made was an accurate one, and it was not. They made things up out of whole cloth, and they cut sentences out of the legislation to meet their needs. It was a wrong decision. So we did the right thing. I suggest those 4 justices did the wrong thing. And that's why we're in this position today.
Thank you, Steve. Now to Emily Davies from WSAW-TV in Wausau. Emily?
Thank you for taking my call. I just wanted to kind of clarify. I don't want to make any assumptions based off of the previous questions that are fairly similar to this, but the court affirmed that obviously DHS and the governor's office has the power to act in this pandemic. Outside of schools remaining closed, which were exempted in the court's decision, what orders from either the governor's office or DHS are still in place as part of the legal authority that both offices have to tackle this pandemic?
Sure, this is Ryan Nelson. I can answer that question. So in terms of the orders issued by the governor solely, one of the things that those were tied to the public health emergency, which the legislature refused to extend. So in addition to impacting some of those orders in Act 185, which was the legislature's very limited response to the COVID pandemic, they tied a number of the provisions in Act 185 to the expiration of the public health emergency, which occurred on May 12th. So a number of those provisions have expired. In terms of orders issued under the Secretary's authority, the court only addressed Safer at Home, and that was the only order at issue. And so all of these are unique circumstances, and you have to take a look at the specific order in terms of its applicability going forward. But I think this raises the challenge and that I have personally with the Supreme Court's decision. Is the majority decision, while it made it clear that Safer at Home is no longer in effect, they didn't provide any guidance whatsoever in terms of what DHS's authority is. You know, the purpose of a Supreme Court is in order to interpret the law, provide clarity on the law, and they completely avoided that in this situation where they, recklessly struck down Safer at Home, didn't provide any stay for any transition period, and then to make matters worse, they didn't provide any clarity in terms of what DHS's authority is or is not. And that's why, unfortunately, now we're gonna have to rely a lot on public health officials in order to be able to stand up and condemn and combat a global pandemic on a local level. We're going to be moving forward with rulemaking. DHS submitted a scope statement to do so today, but I think the court did a great disservice to the state by not providing clarity in terms of what that rule can accomplish.
Thank you, Emily. Now to Jeremy Jeannine from Urban Milwaukee. Jeremy?
With the confusion around the various regulations, will DHS be doing anything public-facing with regard to tracking the local orders, and is there going to be any guidance offered on what should be included in them?
Yeah, so obviously we have we started engaging in conversations with our local public health partners last evening as folks have looked to us for guidance and help in thinking through what they might want to do at the local level, and we will continue to have those conversations as additional local jurisdictions make plans and decisions about what they need and want to do. I think certainly if folks would find it helpful, we would certainly be open to making sure that there is a source of information that tracks that kind of the kind of information you're asking about, but we have not gotten that far in our conversations yet.
Thank you, Jeremy. Now to Morgan Wolf from NBC 15 in Madison. Morgan? Morgan Wolf?
Hi there. Thank you for taking our questions. There's a lot of talk right now about sports. So if we no longer have the Safer at Home order in place, can high school, college, and professional teams start playing again if their organizations chose to? And would you encourage Wisconsinites to stay home and not attend sporting events once they do begin if we're still dealing with the coronavirus?
Well, we have to first figure out whether those events are going to happen before we make a comment about who's going to attend those events. At this point in time, there's, I know the school districts and the university and the NC2A and the WIAA, all those organizations that control those decisions are in the process of discussing them and coming to some conclusions. So it's premature for us to say we don't want people to go to a football game when we don't know if the football game is going to happen.
Thank you, Morgan. Now to Stephanie Hoff from West Politics. Stephanie?
Hi, good afternoon, and thank you for having this call. My question is for Governor Evers. Governor, will you still issue the scope statement for an emergency rule today as promised last night, and what will that proposal look like?
We've released it, and I have to I have to make sure that everybody understands what a scope statement is. It's a long, detailed, or long document that meets some legislative needs around the potential rules. So it's just an overall statement, and it's available now. You should be able to get it any place. I certainly don't have it memorized. What's more important is that scope statement will be published. It's available now. It will be published Monday, and then there's a 10-day waiting time before we can even talk about and put together a rule. And that's what we discussed today, the process of it with the legislative leaders and what that scope statement might mean. So it's one thing I didn't memorize coming in, but one thing that I would like to say, and this is off topic, so I'm not, I don't want people to say, where did this come from? Because it's my understanding that Senator Tiffany just released a statement saying that he's calling for Andrea Palm to resign because she mishandled the Wuhan virus and is killing Wisconsin. Senator Tiffany, please, you just won an election. Just relax. This is an insane statement. We talk about trying to tone down the rhetoric, and I've done everything I can today to do that. And to make a statement like that about someone who has dedicated her life to saving lives, please, sir, give us a break. You're headed to Washington, D.C. This is better. I know you're better than this.
Thank you, Stephanie. Now to Victor from CBS 58 in Milwaukee. Victor?
Hello, good afternoon, and thank you for taking the phone call. Governor Evers, you actually beat me to the punch. I was actually going to ask about the Tiffany thing. But going on the negotiations with the Republican leadership and the majority in the legislature, I wanted to get your reaction if you believe that, based on your discussions thus far, if you believe that they are being done in good faith, and do you think they're being productive to move forward?
Yes. Yes. It made it very clear that having multiple jurisdictions operating in this environment is a good thing. They made it very clear that there's no interest in a gradual reopening of the economy. That was asked of me, and that was our plan, and that's what we were doing as recently as May 1st. So all those things are clear, but and I'm not saying that in a derogatory way. I'm just saying that we have a disagreement there. Do I think we're going to have we will be able to put together we put together a scope statement today that we've released, and that we will continue to have discussions about what is going to be in that opportunity to have some things for the legislature to look at.
Thank you, Victor. Now to Will Cushman from Wiscontext. Will?
Good afternoon. This question is for Secretary-designee Palm or for Dr. Westergaard. You talked about how the work you need to do, testing and contact tracing, remains the same, but the conditions under which you're doing that work have massively changed overnight with the end of the Safer at Home order. And so I'm wondering what specific ways, if any, your strategies with regard to testing or contact tracing have shifted or will shift in the coming weeks.
I appreciate the question. So I think fundamentally things haven't changed. This is a pandemic that we have been working to get an infrastructure up and running to deal with. Wisconsinites have been unbelievable partners in helping us do that, and it's really important now more than ever that they continue to help us do that, whether there is an order or not. And we obviously will We'll be tracking and looking at our data on a daily basis as closely as we have been, so we can spot potential outbreaks, so that we can understand where things might be headed in a world where there might be less physical distancing than under Safer at Home. But the fundamental work that we are doing and that we continue to do with our partners across the state is only more urgent, and we will continue to do that work so we can protect the people of this state moving forward. Dr. Westergaard, if you want to say anything particularly about the data.
Sure. Well, I think for the data, I guess I'd agree. Our strategy is exactly the same. We have pretty clear goals on what we need to build the system to do, and the system is a collaboration between our public health system at state and locals and our healthcare system, which is a huge partner in this. And the goal is for everyone who has symptoms of COVID-19, which are very broad. Any respiratory infection could be COVID-19. Is that anyone who has those symptoms gets tested. Right now we're at a small fraction of that. And the other one is that everyone who is diagnosed as positive gets a very prompt engagement with a contact tracing interview to understand where they've been and who they've been exposed to. So that's been our goal for the whole last 2 months. That's still our goal. We're working at it, like the Secretary said, as urgently as we possibly can to build the capacity to do that with a high level of effectiveness and comprehensiveness. We're making progress, but we're not there yet. So that's the biggest concern, I think, about the risk in the coming weeks after Safer at Home is ended, is that we don't have the system we need yet to be able to prevent small local outbreaks to becoming larger outbreaks. So that's why we need a partnership with residents to work with us and to keep themselves safe, to participate in these processes, to support our local institutions, to make sure that we have close eye on where these outbreaks are, that we can contain them quickly and we can prevent them from spreading. So that's been our strategy the whole time, and we just need to do it bigger and stronger and faster, and we're not giving up on that.
Thank you, Will. Now to Brianna Riley from the Cap Times. Brianna? Brianna Riley? Okay, we're going to move on then to Ben Meyer from WXPR Radio in Rhinelander. Ben?
Good afternoon. Is your administration actively encouraging county health departments to put in their own Safer at Home orders or Safer at Home extensions? I mean, in other words, is the next best thing to not having a statewide order, having as many counties as possible have orders?
Sure, this is Brian Nelson-Stewart. We've received a number of requests from public health officers for guidance on this, and so we provided information, including examples of what they can look at. But this will be a local decision, and it's going to be dependent on local public health officers knowing what's happening in their community, seeing what's happening around the state where you already have more than 400 Wisconsinites having passed away. Looking at over 10,000 people having tested positive, they'll have to take a look at, see what the impact is in their communities, and they'll have to make a decision accordingly. So it's not something the state is mandating, it's not something the state is requiring, but it is something that we're seeing a number of communities around the state proactively reaching out, asking for information and taking action due to the very significant and very deadly risk that COVID-19 presents to people in their communities, especially after the court's reckless decision yesterday.
Thank you, Ben. Now to Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi, thanks again for taking the call. Republican leaders were telling us that they tried to develop a plan with the governor, but he told them to wait for a while. And knowing that the court could overturn the ruling, why was there no backup plan in place? And is that who's really kind of at blame for something like that, not having that backup plan?
We had a plan, they didn't. That's the answer. And the idea that I wanted to wait for the Supreme Court, that's just not an accurate statement. When we met, it was clear to me that Senator Fitzgerald absolutely did want to wait. And so I said, well, I guess we'll wait. But we weren't the group without a plan. We had a plan. We had a plan that's was working. the Supreme Court decided to throw that plan out on very shaky grounds, and the Republicans now own that. So I don't know what else to say. We had a plan. They didn't. The court didn't agree with our plan on shaky grounds. It's simple as that. There is. I hope if the next question I ask, or I'm asked about this, I give the exact same answer, but it's getting repetitive.
Thank you, Casey. Now to Eric Gunn from Wisconsin Examiner. Eric?
Thank you for taking the question. I want to go back to your response to that announcement from Tiffany. Are you concerned, we see in both this state and in other states, the way rhetoric has gotten ramped up? In the Michigan legislature canceled their meeting today because of concerns there. Are you concerned with the way the rhetoric has gotten ramped up around Wisconsin as well as elsewhere around these issues, and reflected in the Supreme Court ruling language of the majority as well?
Yes, I am very concerned about that, and it's against my DNA to respond in kind. Occasionally, I have to do that in order to make a point. But what does concern me about that level of rhetoric is that we tend to forget about the extraordinary work that's being done in the state of Wisconsin and, frankly, our country to rid us of this virus. Obviously, a vaccine's a long way off, but we have thousands of people in our state that are frontline workers that are doing just a hell of a job, and they deserve better than what they're receiving from that comes from the rhetoric. We have made significant gains in the state of Wisconsin, significant gains in the meeting some very specific and high standards of metrics, and instead of celebrating that, we get this kind of stuff from a state senator who is headed to Washington, D.C. We are better than this. We are better than this. I know we are, and that's why going forward, we understand we lost this. We lost it under very, I think, incorrect decision making. But that said, we're moving forward as a state. We are going to spend our time as a state making sure that people that are doing that hard work get the equipment they need. We're going to continue to do testing. We're going to continue to do contact tracing, all the things that will help us. The rhetoric aside, we are going to be focused as a laser on these issues.
Thank you, Eric. Now to Dan Malloy from Spectrum News 1. Dan? Spectrum News? Okay, we'll move on then to Melissa Kim from News 3 in Madison. Melissa? Melissa Kim? Okay, moving on then to Dylan Brogan from Isthmus. Dylan.
Thank you. Dr. Westergaard, do you think there is any difference between voluntary guidelines and mandatory public health orders? We have a situation, right, where Dane County is under safer at home still, but Sauk County has sort of just voluntary guidelines. And can mandatory guidelines work too? And what's your opinion about that?
Well, I guess my opinion or my experience comes from taking care of patients, and I've had many situations where I've had to give advice to a patient about treatment or a vaccine that they disagreed with, and I never once told them you're going to go to jail if you don't do this. In fact, all of those hard conversations start with the same way, which is, as your doctor, I care about you as a person. Whether you take my advice or not, I'm going to continue to care about you as a person and give you the best advice I can. You are ultimately in charge, and my job here is to give advice, to give you information that empowers you to help keep yourself safe. So I translate that same philosophy, I think, to public health, which is to say, we in public health care about our neighbors and our communities. We want them to be safe. It's our role to empower them, to give them education, and to help them make the best decisions. I don't think that the threat of punishment makes people make any better decisions than the ones they do when they trust people giving them good advice. So I think I have every faith that regulations or advice, if they're coming from the place of concern of their well-being from a public health agency that is trusted, it should have, my hope would be, every much as effect. And that's our hope now, is that we're seen as people who care about our community and are giving the best information so people can make the best decisions.
Thank you, Dylan. Now to Jonah Chester from WORT Radio in Madison. Jonah?
Hi, this is Shali filling in for Jonah. I know we've been talking a lot about the Supreme Court decision, but I actually wanted to turn to nursing home data that was released yesterday. I'm wondering, Andrea Palm, if you can explain a little more about what active investigations look like.
The investigation itself.
Yeah.
So this is investigation is the term we use for when we have a suspected or a positive case, and it is that contact tracing, it is that offering of assets and resources, in this case to a long-term care facility to wrap around. Right now, obviously, with them as a priority for us, that could include testing of all residents and staff, making sure that they have the staffing resources they need to protect and serve all the residents who live there, making sure they have adequate isolation capacity within the facility or otherwise, making sure that we are giving good technical assistance on infection control, right? That is long-term care's best defense, is good infection control on the front end to prevent outbreaks. And so we're doing lots of work as long-term care is doing everything they can in individual facilities to prevent outbreaks and positive cases. And so that this term investigation really is that public health work that is triggered by a positive case or the suspicion of a positive case that gives us the signal that we need to focus on that facility in partnership with the leadership there and local public health to do what is necessary to stop the spread in that facility.
Thank you. Now to Rachel from DMJ4 in Milwaukee. Rachel?
Hello. You are now advocating stay the course after safer at home has been deemed unenforceable. But for how long should people stay the course? We were one green light away from phase 1. And then this fall, if we get a large spike, as some experts forecast, will there be a plan to quickly throw a lid back on the state?
Of course, we believe that even in this new environment that we inherited yesterday, that people staying at home as often as possible, not traveling a lot, helping mitigate the virus has always been a voluntary thing. Obviously, we didn't have secret police out there corralling people when they left their homes. But we hope they continue to do that. It's proven to work. We've saved lives, and I know people will continue to stay at home. They may leave more often than now than before because there are more opportunities to interact. But we believe we can keep people safer at home, and if there's a surge, that's why we are doing what we're doing. That's what this is all about, is saving lives, and all the massive testing we're doing, and along with the contact tracing we're doing, and having the proper equipment will help us if and when a surge happens this fall.
Thank you, Rachel. Now to Emily Files from Milwaukee Public Radio. Emily?
Hello, my question. My question's for Secretary Palm. Now that more businesses like restaurants, bars, and salons are reopening, how are you anticipating that will impact contact tracing? And if there is an outbreak that's connected to one of those businesses, will that information be released to the public?
So I would say, first off, we would encourage folks to stay safer at home. We have not met our gating criteria. We are not at 6 greens, and it is not. It would not be safe practice for bars, restaurants, and salons to open. Having said that, if businesses choose to do that, WEDC has offered a number of guidelines in consultation with our experts in public health at the Department of Health Services, and it is why it is critical for our contact tracing assets to grow to that 1,000 target number that we articulated, because we certainly want, every time there is a positive case, to be able to quickly do a contact tracing interview and then pivot to all of the close contacts of that positive case, so that we can do what we need to do to stop the spread of this disease. But Wisconsinites continuing to pitch in and minimize the risk to themselves and to their friends and family by staying safer at home is a critical part of allowing the contact tracing assets, the hospital capacity that we have, not to be overwhelmed by a surge in positive cases. It is why Badger Bounce Back envisioned a phased, so that you could, in a risk-based way, increase the social and physical interaction of people, and then be able to watch the data and make sure that it was at a safe level, and that we could continue to do the work we needed to do and protect the healthcare system, and then turn it a little more and turn it a little more. That was the point of Badger Bounce Back and the phasing, and it will be the work we continue to do. It will be what we continue to recommend from a public health perspective, while we continue to ramp our testing and contact tracing capacity here in Wisconsin.
Thank you, Emily. Now to Janelle Richards from NBC Nightly News. Janelle? And a reminder, *6 to unmute your phones. Janelle Richards from NBC Nightly News.
Hi, can you talk about the COVID test utilization rate and any plan to get the word out to residents?
Yeah, so we here in Wisconsin, one of our significant success stories is our testing capacity. We have some amazing partners, both in the private sector and across the state in our clinical labs, and have a daily testing capacity that fluctuates between 13 and 14,000 tests a day, which does exceed our goal of 85,000 tests a week. We have, as you suggest, been executing or actually doing fewer tests than we have the capacity to do on a daily basis. We have, over the last number of weeks, expanded our criteria for testing and are encouraging anyone who needs a test to get a test, even with the mildest of symptoms. We have increased our messaging around the broadening of symptoms that the CDC recently released, so that people have a better understanding of the kind of symptoms that you might want to be on the lookout for in order to get a test. We also have dramatically increased our targeted testing as it relates to outbreaks. We are focused on our partners in long-term care and making sure that all residents and staff have access to tests over the next month, and our partnership with the National Guard continues to expand so that we have community testing in a variety of communities all around this state, so that we can continue to drive our daily testing numbers closer and closer to our daily target of 12,000 tests a day.
Thank you, Janelle. Now to Bill Ruthart from the Chicago Tribune. Bill?
Yes, thank you. Governor,
As you know, the case levels in Northeast Illinois and the Chicago region have been much higher than in Wisconsin. A lot of businesses in Lake Geneva opening up today and other regions of the state that draw a lot of Chicagoans. How concerned are you about those folks and this influx across the state line? And secondly, since no one else has asked, what's your reaction to President Trump's tweet today, lauding the court decision and applauding how the state has been bustling in the last 12 hours or so?
Yeah, just a quick comment on the tweet. We were following his lead on this, so apparently he doesn't think much of the criteria and metrics that he set out several months ago, because that's exactly the metrics that we are using in order to reopen the state of Wisconsin. So apparently he's abandoned that also. The comment about people moving in, coming in from Illinois, I mean, this has been an issue from the get-go. I've heard comments from people up north and that had concerns about people coming up to their second homes and that what sort of impact that's laying on them as far as supporting additional people in their counties. So that it's going to be a big deal. We will have people coming from Minnesota and Michigan and Illinois to Wisconsin because we have opened haphazardly and without much thought, and that is going to be a problem for us because all the surrounding states have a higher caseload or higher percentage per capita of COVID-19, and it will bring an increase for us.
Thank you, Bill. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Hi, thanks. In yesterday's decision, the majority wrote you have to be able to address emergencies like forest fires. I'm wondering how you are interpreting that. What constitutes a forest fire health emergency under the court's ruling in your view? And at that point, could you issue a new order outside of the rulemaking process?
This is Ryan Elston. I'll address that. As I mentioned earlier, one of the things that's so problematic about the court's decision, majority decision, is, despite the decision overall being 161 pages, we saw from 7 justices, I believe there were 7 different decisions or opinions. The Chief Justice concurred with her own majority opinion, and the majority opinion itself provides us a complete lack of clarity in terms of how the state can respond going forward. And so while the governor still has the ability to declare a state of emergency when there's a wildfire or other things like that, I think the most problematic thing besides their reckless decision to take down Safer at Home, when there's no plan B offered by legislative Republicans, when they haven't offered their plan despite saying they have one for weeks. The big problem with that is the court didn't provide any clarity or guidance on how to move forward. And, whether it's dealing with a global pandemic or you're dealing with a forest fire, sitting down and issuing a scope statement on a Thursday and then having to wait until next Monday for it to be published in the Administrative Code Register, and then waiting 10 days before you can even put pen to paper, and then having to spend however many days it takes to draft a rule and then getting it published in the Wisconsin State Journal. I don't think anybody would agree that that is an efficient or a good process in order to address any type of emergency. And that's why every state in this country has laws similar to what DHS has. That's why the legislature originally enacted these laws. And as the governor said, that despite claiming to be textualist and reading and applying the law as written, the majority decision, frankly, they had to do some creative editing to the statute to get to the result they wanted. And yet, despite being creative in that sense, they didn't provide any guidance on how we can move forward. And so I think that's what's most problematic with this decision, and that's why, as the governor and Secretary Palm indicated, we're going to continue focusing on contact tracing and testing and providing guidance for folks on how to best act. But with the lack of that clarity, it's very problematic.
Thank you, Molly. And our final question this afternoon goes to Tim Stum from Wisconsin Health News. Tim?
Hi.
Hi, thanks for the question. Several county leaders have said in the past 24 hours that they are looking at WEDC guidelines to decide how to help their businesses reopen. And as Ryan mentioned today, many have since then also reached out to the administration for further guidance. As it sounds like an official statewide plan is not happening anytime soon, is the administration considering issuing any additional statewide guidance to help these counties coordinate their response to this?
Well, we'll work with all the counties that ask our advice, and the WEDC has done us a great service in providing those recommendations for gearing up for businesses that are now suddenly opening. So we feel that we'll continue to do that, but our main goal is to make sure that our public health system continues to be strong and do the job that they're continue doing the great job that they're doing around testing and making sure that we have the proper equipment and contact tracing.
Thank you, Tim, and thank you for joining today's media briefing. Please continue to monitor the DHS outbreaks and investigations and COVID-19 web pages for information, data, and guidance. Any additional questions can be sent to dhsmedia@dhs.wisconsin.gov. Thank you, and have a good afternoon.